Hello, I'm Dr. Amrita Kamath, the Acting Associate Chief of Staff for Research at the South Texas Veterans Healthcare System. This year, we are celebrating 96 years of research at the VA. And I want to introduce you to some of the excellent research work that is being performed here at our own VA. We have over 250 projects in diverse areas of research, including the basic sciences, rehabilitation, health sciences, and clinical sciences, using the state-of-the-art technology like human gene therapy, all aimed at improving the quality of our veterans' lives. Please enjoy this video as we highlight some of the current projects performed by our researchers right here at the South Texas VA. Thank you.
So I'm a translational researcher. I'm endocrinologist by training, and I do a study in diabetes and obesity, and I really actually do physiologic studies to understand how body handles the glucose. This is one of the best places in the nation. So when I was looking for a job, this was the position was available, and I was extremely interested in moving in. So the current research project, which is the extension of my work for the last 15 years, is to understand how replumbing the gut changes the glucose metabolism. Diabetes and obesity are two main public health conditions. And veterans, they have diabetes much more prevalent than background population. These conditions are troublesome because they cause so much of the problem. They create actually cardiovascular disease, cancer, many other comorbidities. But at the same time, there is not actually a cure for any of these conditions. So to date, one of the most effective treatments for obesity is weight loss surgery. We don't understand why. So my research is about to understand how replumbing the gut to change the glucose metabolism, improve diabetes.
Whatever helps you helps others. So you should volunteer for stuff like this. You know, as long as it's not going to affect your body itself, I think it's good.
This research unit has been serving the investigators in many different fields for the last 40 years. So it actually has given me opportunities to be able to do these kind of state-of-art physiological studies and be able to help the veterans as well. So I see patients as an endocrinologist here, and there are so many referrals that they come to see me because of glucose abnormalities after these bariatric surgeries. And it's extremely, extremely unique across the nation to have the opportunity to be able to evaluate these veterans firsthand, to just actually, and it's extremely beneficial for their clinical care to be able to do that.
Basically, we know that about 70% of veterans are overweight or obese, and obesity is associated with cardiometabolic disease, which are things like type 2 diabetes and cardiovascular disease. And so we know when we do research studies that we can get people to lose weight actually pretty easily if we do these targeted interventions, and that 5% weight loss is associated with improvements in both your diabetes and cardiovascular disease risk. But what we're not good at is getting people to maintain that. And so this intervention is really about trying to get individuals to be able to maintain weight loss successfully. So we are doing that with what we call intermittent fasting, and that is restricting your calories for specific periods of time. And what I mean is when the individuals will be in this study, some of them will be randomized, so flip of a coin, to either usual care, which is, all right, you've lost weight, now maintain it, and or intermittent fasting, which will involve they'll only eat about 500 calories, but they will do it only 1 day a week. And so that's really helpful for them because you're dieting still, but only 1 day a week, which is a little bit more manageable. And our goal is that we will be able to maintain their body weight at a reduced rate than somebody who had just done the usual care group. From a day-to-day perspective, the research testing, we do things like test individuals' risk for diabetes, which we do with a test called an oral glucose tolerance test. And many women may be familiar with this because we often will do it if we're interested in seeing if women have gestational diabetes when they're pregnant. We are doing functional testing, so things like your balance and your strength. So we'll find out the maximum amount of weight that people can lift one time. We also will do a stress test. We do a test called a resting metabolic rate. And this basically allows us to say if you came in and you were just laying all day long without eating, without moving, how many calories do you need to just be alive? And then we can figure out from your fitness levels and your activity how many calories you need in order to actually lose weight. So it's very individualized in that aspect of it. We are doing, so the optional procedure that he may have been mentioning is a muscle biopsy. And so we are actually taking a little snippet of muscle in individuals who are willing. So that thankfully is an optional procedure. We're doing body composition, so we will do a DEXA scan, which allows us to look at your bone density. And we're doing a CT scan, which allows us to look at your fat and muscle and its relationship and where it's kind of located throughout the body. Once somebody signs the consent form, they will be in this study for about 11 to 12 months total. And that involves about a month of baseline testing, and then they go through 12 weeks of weight loss. Then they go through the exact same testing again. Then they go through 6 months of weight maintenance, and then they go through the testing again. So all the procedures they do 3 different time points. And yeah, so total it'll be about 11 to 12 months if they'll be in the study. The way we make clinical guidelines is often based upon research. And so that would be the number one thing, is that we need volunteers, and we really value our volunteers in order to be able to make decisions for medical care in the future. And so this would potentially drive clinical guidelines when it comes to weight loss and weight maintenance, which, again, considering that over 70% of veterans are overweight and obese, could really change their clinical care.
The San Antonio GREC over the last 15 to 20 years has made major discoveries in the basic mechanisms of aging and has identified novel agents that can improve aging in animal models. And now what we've embarked on over the last 5 to 7 years or so is translating these discoveries from the bench to the bedside. So now we have several studies, including the metformin trial, to examine different pharmacologic interventions and what their impacts are on human aging, including physical function, quality of life, and frailty.
So when I saw this study, I saw it online. It was perfect for me because at my age, and I've retired, I've just turned 65, frailty is an issue. And of course, knowing about bone density also made this study very interesting for me because it's very relevant. I'm concerned, my weight is an issue. Over the years, I saw my A1C creeping up along with my weight. And when my primary care physician gave me the diagnosis of prediabetes, that's what qualified me to join this study. So it's been an eye-opening experience, especially to have the first glucose study done and to see what is happening with your glucose over a 3-hour period. It made it real for me. In other words, it was like the realization is like, this is a real situation that I have to get under control for the quality of my future life. I think most Americans are somewhat in denial, but the average lifespan in the United States is 79. So I want the next 10 to 14 years of my life to be as good as they can be health-wise. And so this study has been a huge eye-opening experience for me.
Many of these trials are investigator-initiated single site, but we also have several multi-site clinical trials ongoing, and we are very excited. In the last few months, we've launched the preventable trial here in San Antonio, here at this VA, and it is a clinical trial of atorvastatin for the prevention of dementia and disability in healthy older adults. So we're actively recruiting for that study as well, and we are one of about 100 sites across the United States.
I'm just very impressed with the Audie Murphy's VA hospital environment. It's just, and I really thank them for allowing the National Health Institute and Dr. Espinosa, use these facilities for the study, because I think a lot of people are going to be helped.
I don't even know how to put it into words. It's just very exciting. But not only the science, but also interacting with these older veterans and getting to take part in their lives and working with them and learning from them, and just the whole process of interacting with the human participants on our clinical trials. It's just very personally and professionally very satisfying and gratifying. And also working with the team of nurses and research assistants and other healthcare professionals here in the Barter Research Unit, and also members on my team. It's just, it's a lot of fun every day, so I love it.
The research activities that they are being done in the research unit, they go from diabetes and obesity, like my research, to age, frailty, post-traumatic syndrome, spinal cord injury. And all of these research are going to be adding to what we know and how we are changing the clinical care. So that's the communication that I'm going to start having with the veteran, to understand why we do what we do, and they are extremely important to the whole process.